Well, stroke is one of the leading causes of death in the United States, and Saturday is World Stroke Day, a day to raise awareness of the signs and symptoms as well as how to prevent them. We're happy to welcome back Dr. Rahul Rahangdale, a neurologist with Ascension Medical Group, to talk about this important topic. Thanks for joining us.
Thanks for having me here today.
Yeah, so we know that this is something that affects so many people. So first off, for people that don't know, what is stroke?
Well, so stroke, basically there are two types of stroke, ischemic strokes and hemorrhagic stroke. A stroke due to sudden blockage in the blood flow to the certain part of the brain is called ischemic. The stroke due to bleeding in the brain due to break in a blood vessel is called hemorrhagic stroke. Now, every 4 out of 5 strokes are ischemic, and every 1 out of 5 strokes are hemorrhagic stroke.
Perfect. And as far as symptoms, how do you know you're experiencing a stroke, or if you're with a family member that they may be experiencing one, that you may need to help them out?
Yeah, so sometimes it's very challenging to diagnose a stroke symptom or sign because they don't come with a single set of symptoms. But there is a acronym which is most commonly used.
Share that with us.
Yeah, so the acronym is B FAST. Where B stands for balance. If there is any difficulty walking, any incoordination. E stands for eyes. If there is any double vision, loss of vision, or any blurry vision. And then F stands for face. If you see the face is drooping or uneven smile. A stands for arm. If there is any weakness of the arm or leg. And then S stands for speech. If there is any difficulty speaking or slurred speech. And then T stands for time. So time is brain. So any one or more of the symptoms are present, it's time to call 911 right away.
And that brings me to my next question. How important would you say is a quick response when it comes to a stroke? It can mean the difference between life and death, I'm sure.
It is. Stroke is very time sensitive. So when it comes to the stroke management, acute stroke management, the first thing we consider is IV thrombolytics, which is IV TPA. And I can give that medication to any acute stroke patient only if they come within certain time. So it is recommended that within 4.5 hours from the last seen well, if that drug can be instituted, we'll expect some good outcomes. I cannot give that medication after 4.5 hours. And the purpose of this medication is if there is any clot in the brain, it can dissolve that clot. But again, before it can actually damage the brain. And the second intervention we can try is the endovascular thrombectomy, which is a minimal accessive surgery where we go through the catheter through a groin or a wrist and try to suck out that clot. Now, these treatments are very effective if they are completed within the time. So even I can tell you that if the patient comes within the time window with very disabling stroke, they are completely aphasic, can't move one side at all. If they get this treatment within the time limit, they can walk out of door next day.
And one last question for you. For those at home that may want to know, how can they prevent stroke? Are there any measures you recommend?
So stroke is preventable. Now, you just need to be on lookout. Know certain numbers, like what is your weight? What is your blood pressure? What is your sugar? What is your cholesterol? If any one of these is elevated or abnormal, talk to your primary care physician how to make lifestyle modifications or if you need any medications. Also know if there are any history of family history of strokes. And again, I think there is a bigger misunderstanding in the community that only elderly population can have a stroke. That is not true. Even young population can have stroke. We see people in their 20s, 30s having a stroke. And again, with this COVID-19, that has increases the risk of having strokes in young. So it is very important.
Well, thank you so much, Doctor. We appreciate you joining us.